Thank you for taking this time to meet with us today. I'm really excited to introduce you to the HuddleMD platform. Before we dive in, I'd like to take a moment to introduce you to our founding team. We have a diverse group of founders with business, medical, and engineering expertise. And what really unites all of us is that we're passionate about this issue. We've seen how detrimental heart failure is for those who suffer, and ultimately got curious as to why this disease is so hard to manage. Personally speaking, my best friend's father was diagnosed with heart failure this past summer. He didn't know he was having difficulty managing it until he went into cardiac arrest in the middle of his daughter's wedding. While he was able to recover, he has no recollection of my best friend's wedding to this day. My friend's father is not an anomaly. Congestive heart failure is responsible for more hospitalizations than all forms of cancer combined, with a staggering 50% of these readmitted within 6 months of discharge. What's interesting is that several studies by the American Heart Association have shown that 40% of hospitalizations for heart failure are entirely preventable. Beyond the cost of human, this also equates to over $3 billion in potential cost savings.
So heart failure has been around for so many decades and is so common. Why have there been no better solutions? We did a lot of research into this problem and found a few common trends. Currently, when we discharge patients from the hospital, we send them home with paperwork and pamphlets that teach them about medication, diet, and exercise. The new technologies and apps in the field all focus on these same 3 interventions: medication, diet, and exercise. But the reality of the situation is that there are so many more factors that come into play that few to no solutions address. For example, does a patient have transportation to their pharmacy? Can they afford medications and healthy food? Do they have the education level to understand complex medication regimens? And many others. These factors are collectively known as the social determinants of health. We dug deeper through a literature review and found that our findings on the importance of social determinants of health have been validated in study after study. Some studies say that while medication therapy accounts for 20% of a patient's overall health, social determinants of health account for the other 80%.
Since social determinants of health are such a large driver of health outcomes, we realize that it's a huge problem that they're so underrepresented in this space. And this is why we built HuddleMD, a digital platform to revolutionize the post-discharge care of congestive heart failure patients. On the left, you're seeing a demo of what our patients see and do use the HuddleMD app. HuddleMD becomes their trusted partner by guiding them step-by-step through their care plan. They enter information in as they complete each step, and HuddleMD gives them immediate feedback as to whether they're on or off track with their care. We build upon the trust by getting to know facets of our patients beyond just the vitals and symptoms, so that when patients do go off track, HuddleMD asks them the right questions so they feel sharing and providing deeper insights as to why they go off track. For care teams using HuddleMD, in real time how patients are doing. And for patients who do go off track, not only does HuddleMD alert them to intervene, but also illuminates for our care teams the story beyond the data of what's actually happening holistically with each patient.
So here's how HuddleMD works. The patient downloads the app and uses it to track their daily symptoms. When HuddleMD detects that symptoms or signs may be going off track, the patient is asked a few targeted questions to better understand the root cause of these changes. That information is then routed to a case manager who's able to connect patients with members of a multidisciplinary care team that most hospitals already employ. These allied care providers are currently underutilized, but by better understanding patient needs, patients can be routed to the providers with the skill set that's most beneficial to them. By better understanding patient lives and better leveraging multidisciplinary care team resources, we are able to improve patient health, lower the rate of readmissions, and lower the cost of care.
Over the past 6 months, our team has made significant progress in terms of developing our fully functioning application. We're piloting the patient side of our platform to test hypotheses around engagement and adherence. We currently have over 20 patients signed up to test and use the product. We also have built partnerships with nonprofit heart failure organizations and have a Q4 launch scheduled with a regional hospital focused on our care management portal for our providers. Our next steps are to fully deploy our algorithm training and product improvements based on the patient pilot data, and to also expand our pilot program to leverage our care team module with the payer so that we can fully demonstrate the efficacy of decreased readmissions and cost savings. In the future, we envision a world where we can further augment the care manager's work using an AI-powered chatbot that would simulate the care manager's initial outreach to the patient and collect relevant data to cut out the initial steps that a care manager would take. Our ultimate goal is to expand the HuddleMD methodology to other chronic disease states where social determinants of health are also integral components for reducing readmissions and improving the quality of life for individuals on a large scale. We thank you for listening and invite you to join the Huddle.